You look so tall right now.
HMP's on the chart. No allergies.
Consent form has been signed.
And consent form has been signed.
Okay, so laps are always open.
Oh, okay.
Okay, at least that. Okay, so laps, and usually you put the ties down so they aren't in the field. Okay. Okay. So incisions that I can make are
Right subcostal or the
subcostal
coker
or
the coker
or midline.
How do you pronounce it?
okay, coker
Coke.
or
Midline.
Midline? If it's a
para
median? Yeah.
okay,
Paramedian.
midline, not usually, it's usually a paramedian or
Yeah.
a transverse.
Bring it in.
Nice. Okay, so I'm going to use a paramedian because somebody got anxious with their appendix here. Okay, so we're going to do
Miss
a
Christine.
paramedian. Okay.
I'm not gonna mention
Now,
names.
if I do a paramedian, I'm going to go through different muscle groups, right? Yes.
Yes.
Okay, so if I do a transverse incision or a subcostal, which muscle groups am I going to go through?
Okay, transverse abdominis and
Director.
internal oblique and external oblique.
Okay, obliques
Obliques.
and the transverse.
First fascia.
Okay, if I'm doing a midline, I'm going to go rectus abdominis, okay, and transverse,
Oh, transverse.
okay, and there's oblique, it's not quite over this far, okay, but the transverse is up on the upper part of your abdomen, the transverse is, so we still have muscle groups there we have to go over, okay, okay, remember that is a skin knife, so what do you do with skin knife?
I remove it.
Okay, okay, okay.
Oh, that would be
Okay,
contaminated.
yes it would, and what would you do with your Mayo stand?
I would have to well, no, but it fell into my instruments, so I have to remove those instruments.
Yeah, no, you'd
Take
just
out the
cover it,
cover
and then you'd be asking your circulator for what?
For new
No.
instruments?
Yeah, because you don't have anything to replace those with,
Do
right?
you want me to still do it?
No.
Pretend?
Okay, so let's throw it away.
We don't have
Can
time
you
for
get
that.
me a new one over there?
That one got worn out.
Yes, it did. It's old. So that, make sure there's not two of them there. Okay, so here, it would be in a peel pack, correct? Okay,
Yeah.
okay,
Yes, it would be.
okay.
This is weird like this.
Okay.
Go ahead.
No, I just said that's for your gallbladder.
Oh, yes.
Okay.
For some reason I thought I heard something
Okay.
different.
Mets. Now, they're used to Bovie for this almost exclusively, okay? And the incision is way bigger than what you're normally going to be seeing, okay? Okay, deep knife. Okay, Kelly. Another one. Okay, so where am I then?
Peritoneum.
Uh-huh. Knife. Okay. And this is where they put their finger underneath and they take the Bovie and they Bovie right on their finger to open the peritoneum.
Okay. Knife for the sake of the
I want
scissors.
Mets. Okay, up. Okay, Balfour. We're going to have it in your belly.
Okay.
Okay?
Look at
Tighten it down.
that. It's Balfour.
All right.
Yeah.
And you don't
Yes.
tighten it as far as it can twist.
Tighten it down because we don't want it
Okay.
moving. Okay? Sponge on a stick.
I'm excited about the Balfour, not gonna lie.
So I'm going to move, this would be wet or dry.
Wet.
Okay? I'm going to move all the stomach contents out of the way because right over the top of this we have the stomach. Okay? It's sitting over here, right where we need to be. So if it is stomach is inflated because remember when we put him to sleep, we're going to get gas sometimes in the stomach. I'm going to ask him to put down an NG tube, nasogastric tube, down the patient's mouth. If he's going to keep it, it goes down his nose. But just for our purposes, they put it down the mouth. So if you're doing a big belly operation with a bowel resection, they're going to be putting it down his nose because he's going to keep it for a week, 2 weeks, whatever it takes for him not to be nauseated and want to throw up. Okay? So I'm going to push the contents away, and I'm going to ask the patient to be put in what position? Okay, now I'll take that wet lap. Okay, now, they sometimes want you to roll them. When you want to roll a lap, you do this, okay? They love rolled laps on histers, okay? So what you do is you roll it like this, and then you do 3. But put the tie in so the instruments don't get caught on it, okay? For our purposes, we're just going to Russian.
Oh.
Okay. So a lot of times they want to, this is great for packing, okay? I need the sweetheart. Alrighty, and then this holds everything back, right? It holds the stomach back, okay? Remember, if I use this, you have to give me a new one, right? Now, you open it, right?
Yes, I have it.
Open the sponge up. You do not throw a sponge away folded up tight.
No.
It gets opened up, okay? Okay? And then make a new one. A lot of times you make 2 for this, and I would, okay? Okay, so I'll take these to start with, okay? Now, in real life, what you see is just that, the gallbladder peeking out, okay? And when I push back the intestines, the small intestines are also attached here by what means? Omentum, right? Okay, lesser omentum attaches it up here. Also, peritoneum. Also, remember what type of peritoneum? Remember we have 2 different kinds, visceral and parietal. So
That would be
this
the
is visceral, right?
It's the organs.
Okay,
Boom.
so
I
now
totally
the
remember
gallbladder's
anatomy.
right there, and you will be able to see it. It's greenish blue color. Okay.
Way better.
Okay. Okay. So then I need a rich, and they could use a deaver also. Okay, and we usually did. Okay. The rich goes on the abdominal wall. No, we're just going to use these 2. The rich goes on the abdominal wall. The deaver goes on the liver. So liver is friable, right? You pull too hard on that deaver, you can tear the capsule on the liver. Yes. I'm not going to be happy with you. Okay, so now I'll take a peon. Okay, and I'm going to grab the liver and I grab the gallbladder and it inverts the liver. So what was posterior now is anterior. Okay, I'll take the short one. Normally I'd use all long ones. Peon.
Yeah. Sorry.
Okay.
I had a moment there.
But we don't have that many, so I'm going to use the short one here, and then do the long one down to what you all had a name for that area.
The cystic duct? No, sorry, no.
Hartman's pouch.
Parchment.
Okay, so that's where I'm going to apply this. Okay, so now we need you. You're part of this operation. You are going to be holding on to this. You take these. Okay, now I need the right angle because right angles go around the lumen and DeBakey's. Okay, so I've gotten this off, and the first structure I want to go find is the duct.
The duct.
Okay, and I'm going to go around it with the right angle. See how it goes around? Okay.
Oh.
Okay.
I trust him. I believe surrounded.
Trust you.
Okay.
Interesting.
We go around the duct. Okay. And I'm taking it off its attachments because I want to ligate it, correct?
Yes.
So, yes, I'm going to need the tie on the passer.
Use this armrest right here.
Okay. Same thing as passing the suture. Keep the tie out of the person's hand you're passing it to. Okay? And make sure it goes all the way out. So then I'm going to take this tie and go down and see how I can then take it to the right angle.
Oh, okay.
Okay, take off that. Okay, a lot of times you want to keep just this, make sure it doesn't fall off. So you'll guide it, and then when he takes it, he'll take it up to there, and he's going to put it in your hand. Okay, another one.
Oh. This is the dynamic has changed. No, this is a short one.
No, you need tonsils.
Oh, yes.
Okay, so we'll take this so you can get another one ready.
Okay.
In real life, you do it one-handed.
Lord have mercy.
Yes, some days it is.
So what do I
Just
just
pull out
practice
one.
to do one-handed, so I can just one regular?
No, you can, I'm letting you do it two-handed.
Okay, sure.
Remember I told you to take it over the top of your hand so it steadies it?
Practice that.
Okay, and
One hand
there it
down.
steadies the, there you go. Okay, now get another one ready, right?
Yes.
Because you know that I'm going to need 4, correct?
Yes.
Because there are a duct and the artery, right? So there's 2 structures I have to tie off.
So I should have these, like when I did put my instruments away, I mean, I put them up here,
Yeah,
I could have these ready so
Yeah.
you
You
know.
have 3 loaded at least.
okay, so take this back.
Okay.
Okay, and I need another one.
I should probably grab this one first. All right then.